So hello guys, the Duke here, and it's been a while since I've done a thyroid cancer update video on the channel, and I thought I'd do a quick recap for any new viewers on the channel. And yeah, my name is Tuukka, I'm 25 years old at the moment. I live in Kuopio, Finland, and fourth year medical student. And back in 2015 I was diagnosed with papillary thyroid cancer at the age of 18. So back in 2015 I underwent major surgery on my neck, so they removed my thyroid completely, and then I have this big scar to show for it. They removed some lymph nodes as well. The tumor I had was about 4 centimeters by 3 centimeters by 2 centimeters. So I got the diagnosis in the emergency department here in Kuopio. I had been complaining about some sort of like a lump here on the side of my neck. It was sort of sore to the touch, like a bruise, and it was sort of visible but not too much. And then yeah, just one day my mom said it's time to go get that checked out, and then we went to the emergency department, and they thought it was lymphoma, and so they took a biopsy and it turned out to be thyroid cancer. So after that I underwent radioactive iodine treatment after the surgery, and then some radiotherapy for 6 weeks, and then radioactive iodine treatment a year later once more. And my checkups have slowly increased in length. So originally they were like every 3 months, every 6 months. Recently they were every 9 months, and now they're once a year. So once a year they take an MRI scan of my neck and my lungs to make sure there's no metastasis or any new signs of growth. And every 6 months they take some blood work, so TSH, T3V, thyroglobulin, and then just like normal calcium stuff and hemoglobin and that sort of stuff. So on the MRI scans there haven't been any new suspects, so there are some nodules, but they've been the same since 2015, so probably just some leftover lymph nodes. In the blood work there's been some rise in the TSH levels. So TSH is what the hypothalamus produces to activate the thyroid tissue. And the idea in thyroid cancer patients is to keep the TSH as low as possible. So in case there's some leftover cancer tissue, the TSH won't activate that. And they keep the TSH levels low by keeping a high thyroxine level, so there's like a negative feedback loop. And my TSH has been slightly on the rise, and it was quite high on the last checkup, which is abnormal. It's been like very steady. So I had some blood work today. Actually I had blood work 1.5 months ago, but they didn't take the thyroglobulin. For some reason the lab failed that, so I went again today. And my doctor raised my thyroxine levels by half of a tablet. So they took the blood work now, and hopefully the TSH has gone down a bit. So I'm still waiting on the thyroglobulin values that they took today. So that's the marker for thyroid cancer, and it's been steady and stable. There hasn't been any dramatic movements in that value. So I'm just hoping it's going to be the same for this one, and that the TSH can just be managed by upping the thyroxine medication. And I've been trying to think about what I want to say on this video, and there are some thoughts that have been on my mind recently. Firstly, it's like funny how your whole well-being or like your health is measured on like one blood work, so the cancer marker, and then that dictates how well you're doing and what your survival is like, and treatments and options and life. And so every 6 months it's like it's always stressful to go into the hospital and get that one sample of blood taken, because it has so much effect on your life. And yeah, that's something that you sort of think about. And now the situation with the cancer has finally gotten to a point where there hasn't been any treatments for like a long time, for 6 years. And there aren't that many symptoms left of the surgery, and I'm feeling okay, that you start to wonder when's it gonna come back and when's it gonna attack when you least expect it. And everything is pretty good now. I'm studying medicine, which has been a goal of mine for a while, and I have a good relationship, and I have 2 cats, and everything's okay with the family. And when's the cancer just gonna say, I'm back, bitches, and hit you in the face? So I'm usually like pretty okay, mental health wise, but then it's just usually the couple of weeks before the blood work or the yearly checkups with the doctor that I sort of start thinking about the situation. And especially the last time, I think it was 6 months or a year ago, I had sort of a bit of a breakdown, because everything is like, it's going so well now, and I would really hate for something to happen that would take that away. And I just like started thinking that, what's the point? That if the doctor calls me next week and says it's gone to shit, and you're gonna have to stop your school for a bit and go for another surgery or take the radioactive iodine treatment again. And it's just like this sort of idea, like, why do I exercise now? I could just lay on the couch instead, because next year I'm not going to be here, so what's it going to matter? Or like why do I save money for the future? Because if I'm not going to be here in the future, there's no point. Or just like this long-term investing like in yourself. And why am I still spending all my days studying when I could be like out there exploring and I don't know, doing other stuff? But you just have to hope that everything's going to be okay, and the time I'm using now to invest in the future, it's not going to be for nothing, and I'll still be there. So that was a tough spot for me, but I'm trying not to think about life that way. I don't usually get emotional when I do these videos, but this one's a tough one. So what I guess I'm trying to say is that cancer makes you appreciate your health quite a lot, and not to take every day for granted, and you just have to deal with that uncertainty that there's going to be setbacks, and who knows, because I got radiotherapy at 18 years old, that I'm going to have a secondary cancer in my neck area when I'm 40 years old. Who knows? But that's no excuse to stop exercising now, or to stop studying or learning, or these kinds of things. That just have to be positive and deal with every day as it goes. But on a lighter side, I was recently doing an internship with anesthesia at the hospital, and I got to see the surgeon who performed my surgery operate on another person. That was pretty cool, and he remembered me still 7 years later. And then there was also the anesthesiologist that put me under for the surgery, so he was there and told me some tricks. And I'm pretty sure I was also in the operating theater that I was in back in 2015. I have a vague memory that it was probably that one. And yeah, so it's the circle is like coming around, and I finally have the chance to learn about that stuff and maybe help others in the future as well. But that's been it for this time, so I'm waiting on my thyroglobulin levels. They should come probably in 2 weeks or so, and hopefully the thyroxine medication has done its job and lowered the TSH levels. And otherwise than that, life goes on and continues, and look forward to the future. So yeah, that's been it. Duke the Duke out. See you in the next video. Peace.